Hi, this is Bedrest Coach Darline Turner, owner and founder of Mamas on Bedrest and Beyond, and welcome to Video Wednesday for today, Wednesday, April the 2nd, 2014. And you may be thinking, oh, she gave the date today. Yes, I did, because today is World Autism Awareness Day, and April is World Autism Awareness Month, so we're going to be talking about autism today. And for those of you who know, I'm kind of dogged about keeping this site and this whole kind of Mamas on Bedrest thing to mamas. Yes, I am deviating a bit and talking about a childhood developmental disorder, but I have just been doing a little research on autism. You know, I've been doing a little bit of research on epigenetics. They're kind of winding themselves around each other, and I have several friends who have children with autism spectrum disorder, and it's just swirling to me. The numbers are staggering. The information that's coming out is amazing, and I really just felt like I needed to share that with you today. So let's start with the basics. What is autism spectrum disorder? Autism spectrum disorder and autism are both general terms for a group of complex brain development disorders. And, it just covers the range. Prior to the publication of the DSM-5, which is the Diagnostic and Statistical Manual, I think it's Diagnosis and Statistical Manual, but whatever the psychiatrists and physicians use to diagnose varying mental health and behavioral health disorders, when they did the revised one in May of 2013, they took all the different disorders on the autism spectrum and grouped them into autism spectrum disorder. Prior to that, your child may have been diagnosed with autistic disorder, childhood disintegrative disorder, pervasive developmental disorder not otherwise specified, or Asperger's syndrome. So those are the terms that we may be more familiar with, but right now you'll hear people say a child has autism or autism spectrum disorder, or is just simply on the spectrum. So what does that mean? Autism spectrum disorder is associated with intellectual disability, difficulties in motor coordination and attention, and physical issues such as sleep and gastrointestinal disturbances. However, you also see children with autism who are brilliant, prodigies in things like visual arts, music, and math. And if any of you remember, there was a movie out, couple decades ago now, starring Dustin Hoffman and Tom Cruise, called Rain Man. And in that movie, Dustin Hoffman was a man who had autism, but he was what we called autism savant. He was brilliant, yet he was autistic. So you can see there are just ranges and varying degrees in autism, and I think that movie was a really pretty cool example of that. It was Hollywood, but it was still fun, and it did give some good information. What we know so far about autism is that its roots are in early brain development, and most children are diagnosed between the ages of 2 and 3. So a lot of parents feel like, well, my baby was fine, and then, this or that happened, and suddenly they were autistic. Well, it's hard to say whether or not the baby was fine, because babies are babies, and it's only as they begin to grow and develop that we can see maybe they're not developing their speech skills, maybe they're not able to crawl, or their motor skills are somehow a little bit slow or impaired. But we don't see that right off because little babies just kind of lay there. However, the earlier we can detect autism, and i.e., when I say we, not only doctors and pediatricians, but also parents, knowing kind of some of the things to look for, the more we can help our children, because there is a lot of research been done. There are a lot of treatments and therapies available, and nowadays kids who have mild to moderate autism or are on the spectrum in mild to moderate categories can really do and live a pretty fulfilling life. So it's really important that there be early diagnosis. Of course, as a parent, what do you look for? What are you looking for? So while it has to be a very specific diagnosis, yes, doctors need to do all their varying tests. as a parent or as a caregiver, if you're playing with a child, 2 years old or so, and they're not giving you big smiles, joyful expressions, happy and exuberant, and they say by 6 months or shortly thereafter, you got to be suspect, because babies do smile and giggle by like 6 months. If you talk to your baby and the baby doesn't talk back to you, and by talking I mean you'll say, hey baby, and they're like, hey. Most babies will respond to you. If they're not responding to you, I won't say worry, but watch it, begin to wonder. Babies should be babbling, if not saying actual words, by 12 months. Words, mama, dada, have words for bottle, sounds for sisters, siblings, whatever, but they should be making sounds and associations with those sounds. They should point. They should indicate. They should go for their toys. If they want something, it should be, they should be able to do that by 12 months. If they're not saying anything by 16 months, you should worry. And I have to say, I was a little bit worried about my son, because he was about 15 months and didn't say anything. He never did. Until one day, my daughter came in and she says, Miles and I want to watch Dora. We want to watch, some Dora video. And I was like, okay, whatever. And as I went for it, he pulled out his pass and he says, mama, no Dora. This is the kid's first words. And what I found was my daughter talked for both of them so much. He never got a word in edgewise. But at that point, he was kind of like, I'm done with Dora. And he spoke up in a complete sentence. Now, that's not the norm. He did say mama. He made sounds and things, but he didn't really speak. But again, you have to tease out, was he not speaking because he couldn't get a word in edgewise because he had an older sister who was a blabbermouth, versus is he not speaking because he has difficulty with speech and verbal skills? These are things that you have to tease out, and if you have questions, chat about it with your pediatrician. And finally, if a child has speech and loses speech, or has a motor skill and starts losing motor skills, then you have to start thinking, well, wait a minute, what's going on? So, it's hard because I don't want to make you feel paranoid. I don't want you to worry. I don't want you thinking, oh my God, there's something wrong with my child. But I do want you to keep alert and to think. And especially if there are anything weird or funky surrounding your labor, delivery, birth, whatever, just keep it in mind. Don't try to make causation, meaning, oh, this happened, then that, or oh, this happened, so that's why. Just keep it in mind. Keep it in mind. So, again, I wanted to speak to you about this because autism is on the rise, and I was going to say we don't know why. There are a lot of theories, and we're going to talk about a few of them now. But according to the U.S. Centers for Disease Control and Prevention, 1 in 68 American children has autism or is on the spectrum. Now, when I wrote the article that I wrote, gosh, it couldn't have been more than 5 or so years ago. It was like 1 in 80. And probably about 5 years before that, it was 1 in 150. So if you notice, the prevalence is increasing in about 5-year increments, if not more. This is just what I saw as a writer. I'm not even studying this stuff, but just in my limited exposure, that's what I'm seeing. Studies show that autism is 4 to 5 times more common in boys than in girls, and an estimated 1 in 42 boys and 1 in 189 girls are diagnosed with autism in the U.S. I mean, excuse me, but 1 in 42 is a huge number. That the odds for that are incredible. It's amazing, it's scary, and we have got to get a handle on this. I mean, our boys are at risk. This is not okay. Worldwide, autism affects some 2 million people and 10 million, It affects 2 million people in the U.S. and tens of millions of people worldwide. So again, this developmental thing, whatever is going on, it's affecting us, and it's affecting us around the world. So it's just incredible. So coming back to why are we seeing this autism? What's going on? And it's amazing because scientists at first were saying, we have no idea, but now we're noticing there are things in our environment, there are things that are going on surrounding the mother's, surrounding mom's pregnancy, and it's really it's amazing. It's really incredible. So what we want to do is kind of look at those things, because a lot of people say, well, life is just what it is. Well, if things in our environment, things in our surroundings, if things around a woman's pregnancy are affecting her baby and outcomes for our children and our society as a whole, well, I think it really behooves us to get to the bottom of this. Autism does have a genetic component. In some people, there is a genetic predisposition. They do know that there is, gene mutation and alteration in gene expression in some children. In others, they don't even know why that's happening, if they don't have the genetic predisposition. Adding to that, they say here, and let me just get it right, the clearest evidence of these autism risk factors involves events before and during birth. This is why I'm bringing this to you, the mamas on bed rest, because if you have a complicated birth where there is a period of hypoxia for the baby, meaning the baby's not getting oxygen, baby labor stalled, or what have you, this is a potential outcome. Again, not saying this to scare you, wanting you to be aware, wanting you to speak with your physician about this. How likely is this to happen? What could happen to me? What could happen to my baby? Be aware. There are some risk factors that can kind of make you an increased risk for autism. They include advanced parental age, which was my case. I was 37 and 40 having my kids. Maternal illness during pregnancy, certain difficulties during birth, particularly those involving periods of oxygen deprivation to the baby's brain, real kind of crash delivery. These things put the baby at increased risk, especially if there is a familial predisposition or genetic predisposition. One thing that is a good thing is that a growing body of evidence shows that women who take a really good prenatal vitamin with at least, and I say at least because we've talked about this with our supplements before, with at least 600 micrograms of folic acid a day can reduce the risk of autism. Now, I've read things that say at least 1,000 micrograms a day. So, again, discuss that with your physician. And I am aware of and have a really great prenatal vitamin that I recommend for people if they are so interested. You can talk to me, info@mamasonbedrest.com. Just throwing that out there, and I will put that in the header to this video rather. It's not a DVD yet. One thing I did want to bring up, because it's always going to come up, is people say, well, we have the increase in autism because of vaccinations. I don't know. Personally, I vaccinated my children because I know that the risks of developing measles, mumps, rubella, smallpox, and a whole host of other stuff, polio, is deadly. I mean, it's that simple. It can be deadly. And I did not want that for my children. The evidence, the scientific research evidence, has not yet been able to link vaccinating your child with, and I think right now it's the MMR, measles, mumps, rubella vaccine, with autism. There are people all across the board, some say yes, some say no. You're going to have to really do your research, talk with your pediatricians, and come to a decision on that yourself. What I will say is currently the medical evidence in the United States does not support it. Now, there are many things we didn't support at one time and things change, or we did support and then it changed. And with that, I say you have to keep your eye on the literature. You have to read. You have to educate yourself. And you really have to learn and weigh the pros and cons. For me, it was a matter of, I had seen in my training a couple of kids with measles and rubella, and it was nasty. I had patients who had polio and had some severe disfiguring physical problems. So when I had my kids, for me it was a no-brainer. They got vaccinated. One thing I did do was I slowed down the rate of vaccinations, especially for my son. One time I went in, he was a tiny baby, and they gave him 5 vaccinations. And I was like, absolutely not. Under any circumstance are you ever to give him that many vaccines at once. And I cut them back to him only having one per leg per visit. And they were like, well, you're going to have to come in and have more. And I'm like, I think I can afford the $20 copay. Now, for some people, they may say, I just can't do that or what have you, but you have to make decisions. You have to kind of get within your mind and within your heart what is best for you, what is best for your family, and make that decision. That is the decision I made based on the medical evidence that I saw, and that's kind of where things shook out for me. So there is a lot of research going on. There is a lot of information out there, far better than it was, say, even 5 years ago. I really want to encourage you to take a look, to educate yourself, to learn what is out there and what is going to be best for you and your baby and your family and your future. Granted, no one knows for sure, but I'm saying make at least an educated decision. And in the process, think about the moms and dads, out there who have children with autism. If you know of anyone who has a child with autism, kind of give them a heads up today. Hey, how you doing? It's Autism Awareness Day. Just wanted to say, hey, acknowledge it because, these parents, they do have a long way to go. These children have a long road to hoe. And I think the more we all know, the better things will be. And also as we learn more about environmental cues and, things that we're able to do, whether it be stress reduction and, exposures to toxins, what have you, we have to put pressure on the authorities to not make our environments toxic. It's that simple. We can do this. We can demand that we not be around toxic substances, toxic chemicals, toxic environments, toxic situations, but we have to stand and we have to speak. Everybody feels like, well, I'm just one person. Well, if we all speak, we're not just one person, and we can do this. Okay, that was a little bit of a rant, but I get a little impassioned about this because this really is our children. This is our boys, 1 in 42, holy moly. And we need to speak. And as they say, Autism Speaks. That's one of the organizations that's been doing a lot of the research. I strongly suggest that you check it out, learn, educate yourself, and just know. I'm not going to say be prepared. I think it's just important that you know, because with these numbers where they are today, you're going to run into a family with an autistic child. And it just would be nice if you knew kind of what they're dealing with. So happy World Autism Awareness Day, everyone. And happy World Autism Awareness Month for April of 2014. Today is April the 2nd, 2014. Thank you for tuning in. I'm Darline Turner, Bedrest Coach, owner and founder of Mamas on Bedrest and Beyond. Have a great day.